thank each and every one of you for coming. It's you get a different perspective of standing out here and looking out into the crowd, and you know, I know each and every one of you, your family members, your friends, and we also recognize the sacrifice that each one of you go through in order to make this event and this possible for them to be here to participate. One of the things that I get to do is, of course, welcome you to Nash Community College, and on behalf of the president of Nash Community College, who is sick, unfortunately, he needs one of you all to take care of him tonight. And the Nash Community College Board of Trustees, we welcome you to the college, and thank you for being here. One of the things that you never know is that when something is going to kind of hit you in the face and remind you what things are all about, why the college is here, why the students are here. I look out at the graduates, the candidates for graduation, and I recognize a number of them from time to time because I work with students in my office. I see them on a daily basis. Students are in and out of my office, and we talk about different things, and we work on different issues. We work on different problems, and just to have, and I want to, you know, I won't call it by name, but just to say thank you for coming up to me and saying what you said tonight. That certainly means a whole lot to me, because you never really know unless someone tells you. A few years ago, I had cancer, and I was in the hospital for quite a while, and was people like you who work with me to help me on a daily basis to get through that, and to bring me back to where I am today, so I can stand up here in front of each and every one of you. I look out at the crowd, and I see one of my daughter's friends from elementary school, and see that, you know, that's wonderful that they're here, they're going forward, and that they have ambitions and things in their lives. Jessica, you know, it dawned on me not long ago, and that you were in my office, and we're glad that we're able to help you through and see where you all are today. Now, I would be remiss, and Dr. Carver, the president, would get on me if I didn't remind you that when you finally reach your goal to where you want to, whether it be Nurse Aide 1, 2, whether it be in the nursing program, nurse practitioner, wherever you want to get in the health field, that I want to remind you that as we give to the students, don't forget to give back to the college. Don't forget to help other students so that they could be sitting where you are tonight. Because that's one of the things that we do, and we try to work with all students and help them as much as we possibly can. Now, I told them earlier tonight, asked them how long I could speak. Somebody said 3 seconds, and so I think I have gone past that. And I just want to welcome each and every one of you to the college, and we look forward to seeing your graduates walk across stage tonight. Thank you.
Good evening. It is my pleasure and privilege to introduce our speaker for this evening, Ms. Lee Bennett Bailey, BSN, RN, Nurse Liaison, Nash Health Care Systems. Ms. Bailey is a graduate of Rocky Mount Senior High. After high school, she went on to earn her Bachelor of Science in Nursing from the University of North Carolina at Chapel Hill. After graduation from UNC, she worked as an orthopedic surgery nurse at UNC hospitals for 2 years. Since coming to Nash Health Care Systems, Ms. Bailey has worked as a critical care nurse and as a critical nurse educator. For the past 3 years, Ms. Bailey has been the nurse liaison at Nash Health Care Systems. As the Nash Health Care Systems nurse liaison, Ms. Bailey works closely with area university and community college schools of nursing to facilitate student clinical and preceptorship experiences. In addition to her responsibilities as liaison, she also serves as coordinator of the nurse residency and nurse extern programs, chairperson of the nursing peer review committee, and coordinator of the community outreach program. Ms. Bailey also serves on the Nursing Education Council and Nursing Quality Council, is certified as an instructor and teacher in basic life support and advanced cardiac life support, and volunteers as a nurse at the Tar River Mission Clinic. Ms. Bailey is married to Al Bailey and lives in the Red Oak community. She has 2 children who are both students at North Carolina State University. At this time, I am pleased to turn the floor over to our honored guest, Ms. Lee Bailey.
Thank you, Valerie. I must update that a little bit. I have been the nurse liaison now for 5 years at Nash Healthcare Systems since I last submitted that, and I am glad and proud to say that both of my children are now graduates of North Carolina State University and out in the working world, so I'm very thankful for that. Well, good evening, distinguished faculty, Dr. Smith, Mr. Mitchell, families, and guests. I want to thank you for inviting me here this evening as you celebrate the accomplishments of this fine-looking group, 80, I believe, proud graduates, as they begin to consider their new profession as a certified nurse assistant. Now, have no fear. I'm well aware that on an evening of such high excitement, that what you require first and foremost of any speaker is brevity. Now, I will not fail you in this respect. There are exactly 132 sentences in my speech, 5 of which you have just heard. So it will take me about 13 minutes to speak all of them. And I must tell you that this was not easy for me to do because I have chosen to talk to you this evening about the art of compassion. Now, before I begin, I must share with you a couple of humorous anecdotes involving this particular class of graduates. Now, I don't tell you these things to try to embarrass anybody, but rather to show you just how far that they have come in their quest for excellent patient care. So students, have you been going to the gym lately and pumping iron? Or better yet, have you been lifting any soup cans lately? Well, in order to pull up those patients in bed, you're going to have to buff up a little bit so that when you go 1, 2, 3, the patient will actually move to the head of the bed. Well, maybe we just need to add some Wheaties to their diet. Now, another little story I heard about this class involves the very important task of specimen collection. Anybody up for some chocolate pudding this evening? Maybe they have some of that back on the refreshment table back there later on. Let's hope. Last of all, I want to let you know I want to ask you whether or not you have learned the lesson that the instructor knows best. If you have, then you'll know that on clinical days you will stay cool and fresh in your uniform. For the ones who did not have on their listening ears, then you will sweat in your long-sleeve t-shirts under your uniform. Is that right? I see some heads going like this. The moral of these stories is listen to your instructors because they really do know best. The Dalai Lama has long been quoted as saying, if you want others to be happy, practice compassion. If you want to be happy, practice compassion. That statement holds a great deal of meaning for us all because the more we care for the happiness of others, the greater our own sense of well-being becomes. Now, I'm not a religious follower of the Dalai Lama, but I do believe that he has a great deal of insight on the topics of caring and compassion. Cultivating a close, warm-hearted feeling for others automatically puts the mind at ease. As we strive to become more compassionate, that is, to develop genuine sympathy for others' suffering and the will to help remove their pain, we increase our own serenity and inner strength. Care, compassion, and respect have always been enshrined in the value statements of healthcare professions. However, the term compassion has recently gained a much higher profile with healthcare providers and policymakers. As a matter of fact, just a few weeks ago, I was attending an advisory board meeting at one of the local schools of nursing, actually at Barton College. And the main topic of discussion was, of course, compassion and its importance in the making of a great nurse. As I had already prepared this talk, I thought to myself that I had really hit the nail on the head when I chose my topic. So this evening, I want us to look a little more closely at compassionate care, what it is, what prevents it, and what enables staff day in and day out to be compassionate toward every patient in their care. Now, quality nursing care is not about throwing yourself into your work, and it goes beyond doing your assigned tasks perfectly. It's more than the accolades that you receive for a job well done. Nursing care means being compassionate, feeling what your patients are feeling, and understanding what they are going through. Being a compassionate caregiver means a whole lot to a patient and to the institution who promises to give service to those in need. But what does compassionate care really mean, and why is it important? Compassionate work means understanding your patient. It means that the loss of a loved one or a threat to their health really is a big deal for them, and it must not be taken lightly. So you are being looked up to by them to explain things patiently, clearly, and kindly. Sometimes your patient may not feel that they can trust your judgment, and they may even blame you for their misfortune that befell them. So don't just walk out after giving them your explanation. Compassionate care means being able to reach out to them even though they may be pounding and blaming on you. Treat your patients with respect, whether or not they are rich or poor. Sometimes practitioners give preference to those who can pay their rates. But true service means providing everyone with equal treatment. Be open and frank to your patient and to your patient's family in a way that they can well understand what you're saying. Give them what they deserve. Sometimes give them more than what they expect. Give them the kind of care that you would want for yourself, for your family, or for your loved one. Now, you can't be their room service, but sometimes just a touch, a simple pat on the arm, or a smile goes a very long way. Now, you know that being in the hospital, a long-term care facility, or a clinic is the last place that they want to be, and you are there to extend not only your help, but your comfort as well. So compassionate care matters to all patients. It's the presence or absence of compassion that often marks the lasting and vivid memories that patients and family members retain about the overall experience in the hospital or any other healthcare setting. So to put it simply, they will remember you and the touch that you gave them, the time that you took to sit and hold their hand when they were afraid, and the support that you gave to the family of an ill or a dying patient. So can I just stop right here and tell you that I really, really love being a nurse. I really do. You want to know why? I'm going to tell you my own true story here. Now, the other day we had a large influx of patients, and I was called to help out in staffing in our emergency room. One of the patients that I was caring for was a 93-year-old gentleman admitted with an acute bowel obstruction. He had come in from a long-term care facility and had a lengthy list of medical problems, including metastatic prostate cancer. But despite all that, his mind was keen and sharp as a tack, and he was really a delightful gentleman. So in about 5 minutes, he told me what occurred that caused him to come to the emergency room. He told me all about his medical history. He told me all about his pain. He told me all about his other symptoms. And he told me about his former wife, the love of his life, who had passed away 10 years ago. He also told me that her name happened to be Lee. In fact, during those 5 minutes, he told me pretty much his entire life story. Now, during the course of the next few hours, I provided good basic nursing care for him. I explained to him why I was performing those particular interventions. I alleviated his pain. I called his family to let them know that he was in our emergency department, and I eventually transferred him to a bed on the surgical floor. So that's pretty simple, wouldn't you say? Just another routine day in the emergency room. When I got ready to leave, he took my hand and with tears in his eyes, he thanked me for what I did and said that I helped him feel much better. Imagine that. I didn't operate on him to alleviate his bowel obstruction, nor did I cure his metastatic cancer. But to be able to help that gentleman who was my patient with such simple acts of nursing care in such a way that made him feel better. Now that, my friends, is why I became a nurse. It's plain and simple. That's just Compassion 101. By the way, do you know who of the two of us received the bigger blessing that day? It wasn't him. It was me, of course. Now, research shows that compassion affects the effectiveness of treatment. For example, patients who are treated by a compassionate caregiver tend to share more information about their symptoms and concerns. So this in turn yields a more accurate understanding and diagnosis. In addition, since anxiety and fear delay healing and compassionate behavior reduces patient anxiety, it seems likely that compassionate care can have positive effects on the patient's rate of recovery and ability to heal. So you see, it's a very simple formula. Compassion, in simple terms, is a deep awareness of the suffering of another coupled with the wish to relieve it. Now, graduates, this is where the going really gets tough. Compassion requires that you give something of yourself. When fatigue, personal factors, or other circumstances create stress in your life, it becomes more difficult for you to feel and show compassion. So you say to yourself, because I had that big fight last night with my spouse, I'm in a bad mood and I'm just not feeling like coming in today and taking care of anybody else's needs. But you see, it's not about you. It's about your patient. So put your personal problems on the back burner and be ready to provide that kind of care that your patient deserves, the kind of care that you want for yourself, for your child, for your significant other, or for your parent. So what are some of the elements of compassion? Compassion starts with good basic care and can be demonstrated in very practical ways. For example, make sure your patient's feeding needs are met, that their pain is managed, and that they are helped to the bathroom as needed. Make sure that they have a clean bed or room and that the call light is within reach. Give your male patient a much-needed shave or help your patient wash his or her hair. Compassion involves empathy, respect, and recognition of the uniqueness of another individual. Compassion means that communication is human to human rather than clinician to patient. The compassionate caregiver never stereotypes, but appreciates differences and recognizes the common humanity shared by both patient and caregiver. Compassion should not necessarily be seen as being sweet and nice, but it includes honesty and may require courage. In short, for healthcare professionals, compassion means seeing the person and the patient at all times and at all points of care. Now, if you recall, I began this talk by quoting the Dalai Lama as saying, if you want others to be happy, practice compassion. If you want to be happy, practice compassion. My friends, make it your goal and your mission in life to be compassionate caregivers. Focus on being loving and kind, and in turn, you will be rewarded with love and kindness. So take to heart these quotes. For that which man sows, he will also reap. What goes around comes around. And do unto others as you would have them do unto you. There's also a poem that was shared with me by Ms. Winstead, and because I think it's very fitting, I would like to share it with you. You are never referred to as only a CNA. You are the ones who wash and dress the patients for the day. You are the one who takes the time to listen to them speak about their lifetime. It's not always easy being a caregiver. You're never quite prepared. You're always lending a hand when someone's feeling scared. For all these reasons and more, we celebrate you today. We realize that we are blessed to help nurture such wonderful CNAs. That's a great poem. So today I want you to reflect on these thoughts and to be compassionate that you might achieve an abiding and personal happiness and that you might be that special nurse that the patient remembered. Now you're all about to begin a new chapter in your lives as certified nursing assistants. I congratulate and I thank you because certified nursing assistants are truly the backbone of both long-term and acute care. We could not do this job of nursing without you and the care that you render to your patients. I do encourage you to make this journey one of lifelong learning. I hope many of you will continue with your education and will one day become registered nurses or other healthcare providers. As you continue on this journey, I wish you much success. Once again, congratulations to you all and to everyone who has supported you throughout your education. Good luck. God bless you all, and have a very Merry Christmas. Thank you.
Thank you so much, Lee. Well, congratulations, students, graduates. It's wonderful to see that sea of blue and white out there. But before I get to introducing you, I would be remiss if I didn't take a moment to thank all the staff at Nash Community that makes the Nurse Aide program possible, and particularly those that work in the Nurse Aide department. On the stand with me, I know that the program says Faye Figluski, but this is not Faye Figluski. This is Cherie Winstead. Ms. Winstead was recently given a position at Nash as a full-time instructor. She'd been part-time for about 3 years. She was recently given a position as a full-time instructor, and I'm delighted to have her on staff full-time with me. She teaches the daytime class. She's taught the evening classes, trying to move her now to daytime full-time. Debbie Green, Miss Green, if you would stand, please. And Helen Perry. Miss Perry snuck in at the last, so she thought I might. Both of these ladies, as well as several other instructors, make my job possible and make this program possible. I appreciate all the things that Ms. Bailey said to you, and I want to take just a couple of minutes to add just a couple of things to that. She talked about compassion, about taking care of your patients. Remember that compassion has to extend to yourself as well. You cannot give from an empty vessel. You cannot give what you do not have. So in the midst of going to school and taking care of your family and learning to take care of your patients, don't forget to take a minute to take care of yourselves. It's not selfish, it's necessary. And it is the right thing to do if you want to take care of other people. You've got to take care of yourself. You've got to be able to give what you have. I also want to encourage you as you go forward into the healthcare field for you to continue to do the things the way that you were taught to do them in school. When we go out in life, it is always wonderful when we can find a good example to follow. Sometimes you will get out into life, not just in school or in work, in many different fields in life. You may get out and look around and you find that there's not an example for you to follow, or not a good example for you to follow. That means it's your turn to be the good example. That means that you're the one that now has to step up to the plate and do things correctly so that others can follow you. I have 2 children, 2 sons, who are grown. And I remember telling them as they were growing up, when they, oh, everybody's doing this, everybody's doing that. You can follow the crowd if you would like to. I've never seen the crowd end up any place I wanted to be. Be your own person, set your own goals, and then work hard to reach them. You have to make your plan, and you have to work it. No one else will make it for you. No one else will work it for you. You've all taken a huge step in the right direction, and we are proud to have you go out into the community, whether you go directly into healthcare or you go into other health-related classes. We are proud to have you go out into the community and represent Nash Community College. We're proud to have you go out and say that you came through the nurse aid program here. So congratulations to all of you, and I'll add, as Ms. Bailey said, Merry Christmas to each of you. Get you. And now we're going to present our graduates. Rachel Baines. Landon Batten. Congratulations. Yazan Bayer. Arlene Bishop Geis. Lori Brewer. Lynette Coltrap. Congratulations, Lynette. Miranda Edwards. It's okay. Amanda Enruthy. Amanda Faircloth. Maya Grimm. Elvia Hernandez. Andrea Hawks. Kara Johnson. Rosa Johnson. Pamela Keel. Tammy King. Jasmine Leonard. Morgan Lewis. Treasury Lynch. Marla Matthews. Kelly O'Brien. Congratulations. Brittany Pendergrass. You make it, girl. Kadisha Perry. Valerie Pirtle. Brittany Pittman. Jenny Pittman. Carla Price. Brittany Privet. Michelle Ramsey. Juliet Sharp. Tammy Smith. Stacy Struck-Wallarcy. I practiced that. Candace Summerlin. Samantha Trejo. Crystal Turner. Larissa Vines. Christy Wainwright. Congrats, little girl. Brittany Ward. Atasia Ware. Congratulations, Steve. Tatiana Warren. Jessica Weber. Shaquila Wheeler. Amy Whitley. Crystal Williams. And now it's my pleasure to introduce our Nurse Aide 2 graduates. Takeda Brinkley. Congratulations. Caitlin Finch. Sarah Fortenberry. Peggy Hardy. Tanisha Hines. Chelsea Hutzel. Beverly Parrish. Kashawn Seabreeze. Congratulations. Grayson Smith. That was the quietest presentation I think we've ever had. especially with a crowd this large. We usually have families hooping and hollering. Let's give our graduates a good round of applause.